Not being able to catch their breath puts thousands of Mid-Southerners at risk. They suffer from a condition called COPD, a leading cause of death in the U.S. As Rod Starnes explains in our cover story, a new outpatient program is helping many breathe easier.
After a challenging career on Memphis's Cotton Row, retired cotton merchant David Brandon has a new challenge today, COPD.
Chronic obstructive pulmonary disease. This restricts the amount of air that you can take in. So you're huffing and puffing, and it sort of detracts from what else you're trying to do because you're so interested in trying to make sure you get the breath.
Brandon is one of millions of people suffering from COPD, but a new program at Baptist Hospital DeSoto is working with some of them to get them back to living more normal lives through an outpatient pulmonary rehabilitation program. Respiratory therapists like Scotty Langston teach specialized exercises that will show patients ways to overcome breathing problems.
We do a couple different techniques. One is called pursed lip breathing, which is where the patient breathes in through their nose and blows out through their mouth, which helps to keep some of their smaller airways open so they can have a longer exhalation period so they can get a deeper breath. And we also use a technique called diaphragmatic breathing, which helps them to use their diaphragm.
Patients take part in 1 or 2 hour classes where respiratory therapists help them improve their endurance. Without therapy, pulmonary patients can suffer serious issues. One of the doctors at Baptist DeSoto says that COPD is one of the leading causes of death in the U.S., and the illness is to blame for long-term disability, especially when patients don't get consistent care.
They can be very serious. They can be very debilitating when they reach a certain point. So we have patients that come in who are very debilitated, and we teach them techniques that they can use to improve their daily lives.
Brandon says he's able to do more on his own now, whether it's running errands, taking care of things around the house, or just enjoying himself. What he's learned has been really effective. He says it's more than he's gotten from other pulmonary programs, and it has given him the tools he needs to deal with the challenges of COPD and get more out of life.
It does. I think it motivates you. I think it gives you an idea that you can do something by what they do for you. And the breathing exercises they give you, the puff, the breathe in and so forth, that's very helpful.
For Smart Medicine, I'm Rod Starnes.